Education, the current undergraduate education in India, by far and large, is not of high quality. It does not really enable the graduate to confidently start his practice.
Welcome to another episode of Hall of Fame interview. Today we have with us Sandeep Jose, the homeopathy practitioner, and he is from Kochi, Kerala. His son is training from Calicut and Mumbai. He is having a very fantastic practice in Kochi. So welcome and congratulations, Sandeep sir. How are you?
Thank you. Thank you for having me here.
You are running a very good practice in Kochi, right?
Yes.
You are doing it for the last 25 years.
25 years, yes.
Homeopathy. Why homeopathy?
I got into homeopathy by chance. Then, because once I did my schooling in Tamil Nadu, and I was aiming for MBBS, but it so happened that I needed to either be a domicile of Tamil Nadu, or I should have studied there for 4 years. But I could only do schooling for 3 years, so I missed that bus there. Although I qualified in terms of marks in my +2, I got about 95, more than 95% in my subjects. So although I qualified there, I was not eligible due to this criteria. And when I came back to my home state, Kerala, it was not based upon marks, it was entrance test, for which I was hardly prepared, which I did anyway. And then what I got selected was for homeopathy. Then once I did the graduation, I was not still confident of starting my own practice. And that is when I came to know about an institute in Mumbai called Institute of Clinical Research. It is run by professionals, and they were having a small hospital where you are getting both clinical training as well as training in homeopathy. That's why I got got more confidence, got good clinical exposure, and the confidence to start my own practice. I did it. I was there in Mumbai for 1.5 years. Once I came back, I started my practice, and it grew gradually. And after some time, there was still some results were still not coming forth in many cases, which I wanted to see. That is when I came across another academy in Mumbai called the Predictive Academy. So I did a course with them over seminars online, and that helped me to break the ceiling. And from there, practice really flourished. So for the last 5 to 8 years, the practice has been going pretty well. And I wanted to take it to the next step in terms of revenue. That is when I heard about Doctorpreneur Academy, and I signed up for that. I like the support system you're giving, and also the modules you've laid out in your course, which can help anybody who is willing to invest the time to better their practice. Because today I realize that when I started my practice, and even when my practice was growing very well, the relevance of social media was there, but it was not very evident to me, and I did not know how to use social media to leverage, my practice to make myself known. Because today, more and more people, because the word of mouth publicity, I feel that limitation is reached. I'm living in a place where there's a lot of floating population, and also Kochi is also, there are a lot of IT companies coming, so a lot of people coming from other states, and there are a lot of floating population. So there's a limit to which my practice will grow with word of mouth publicity. So I knew it is time for me, if I wanted to grow my practice further, I knew it is time for me to step up. And also the support, if so, I also have interest in developing a chain of clinics, because I have a lot of experience in curing allergic disease, which is very rampant, asthma, allergy. A lot of people are suffering. And most of them came to me after they were not getting cured. Many people are getting relieved with contemporary medicines, but they are not getting cured. So I had a lot of people coming, and I had a lot of experience that way. And that is a potential I saw, particularly in a city like Cochin, where allergy is very high. So my next step, what my further ambition was to set up a chain of clinics, leveraging my domain knowledge in treating allergy cases successfully. So that is for that, how to set up those clinics, all those, because when you're enlarging your establishment, there are other things involved. So what I see in Doctorpreneur is that there is already a lot of knowledge. That is not knowledge, it is experiential knowledge, like you say, wisdom. Wisdom is there. The people who have done this, who learned the ropes of it, who knew the pros and cons, so that I would make less mistakes when I set up my own establishment. So this is what I am looking for. This is what the value I see in Doctorpreneur.
We have done some postgraduate courses. Elaborate on that because many people are not aware about all these courses.
Yes, because see, although the homeopathic system as such has a lot of potential to deliver benefits to people. The education, the current undergraduate education in India, by far and large, is not of high quality. It does not really enable the graduate to confidently start his practice. So that is what we see. Most of the graduates are still, they just know the basics, but they're really confused as to become effective clinicians. They're not equipped by the undergraduate course. The Institute of Clinical Research, Mumbai, had a setup where they have allopathic doctors, and along with that you have homeopathic doctors. So the homeopathic doctor undergraduate can gain domain expertise. So while I was there, for example, along with a senior consultant, I used to go to a hospital where they're treating children with epilepsy. So after that exposure, I got a lot of specific knowledge about epilepsy, disorders of epilepsy. So with that knowledge, I could successfully treat children with epilepsy. Likewise, there are the different pediatrics. There are a lot of, I was in that hospital, I had a lot of experience in good pediatrician examining babies, findings, etc., clinical findings. So there's all a lot of hands-on learning from there. So that clinical exposure, because in homeopathy, when you want to really deliver results, you should know how to diagnose properly. Along with that, you should know how to apply your homeopathic medicines correctly to the patient. So that exposure is what I got from ICR, where a lot of the clinical training aspect I got from there, as well as I was able to better myself in the application of homeopathic medicines. I came back from there and I started my practice. I rolled out my practice, and as it went further, I was not very happy with the results. I wanted to see patients getting better faster. For example, if I was treating cases with somebody coming down with high fever or influenza, as you can fever, cough, the normal viral fevers, they were getting better within 3 days at that time, 3 days. I was thinking, but that is not good enough. People should get faster, get better faster. So I was not really happy with my results, although my practice was flourishing. And that is when I came to know about the Predictive Academy, where they were teaching you how to improve your results. So with their expertise, from what the knowledge I got there from there, I was able to cure patients. I was able to give better results faster pace of time. So for then thereafter, all my acute problems, like acute diseases like viral fevers or cough, cold, and all would be getting better within 24 hours, or even shorter than that. So that is what I was looking for. So once a patient comes to me, I want to see the patient back to work or back to school the next day. That was my aim. So I was able to do that, and that gave me a lot of satisfaction professionally. Also, then I started improving quality of my output in treating patients with chronic disorders, which form the bulk of my practice. So, and gradually, because living in a city like Cochin, where there's enough and more pollution, allergies are plenty. A lot of people with asthma, a lot of people with chronic allergy, chronic lung disorders, and so I started getting exposure to them. I was able to help people get off being, a lot of people were dependent upon medicines, be it in any form, some homeopathy, whatever, contemporary medicines. A lot of people were dependent upon, they want to break free. So I was able to deliver that. I started focusing on that. So this training helped me get there. And after a few years, I did still find that some cases were still challenging. I was not able to give the results that I wanted to. That is when I also got exposure with one Dr. Pradeep Gupta. He's running a very successful medical college come hospital called the Namenath Homeopathic Hospital in Agra. So I got a lot of, he comes with years and years of experience treating very complicated cases and with very quick results. So that was my focus of my interest also. I wanted to just not, give up sort of symptomatic relief. I wanted to get rid of the disease, make them healthy, back to health. So when you're in health, like what I understood is you're not dependent upon medicine. You don't require medicines when you're in health. So that is also my aim. So then I've been using which I gained from him for the last 2 years. And that has helped me to, that has actually given me another tool when I am treating patients. So it is now when a patient comes to me, I have more tools at my disposal to employ. So if I don't see the results with one approach, I will change and employ medicines in a different way to bring about results.
Yeah.
So that way the rate of my failures have come down a lot.
All these new techniques that you learned, that there was a change of regime or what, change of dosage or something, different drugs.
Yes, there's a change of dosage, definitely. When I came from Dr. Pradeep Gupta of Namenath Medical College, it was mainly about change of dosage. So that was a big learning for me. Dosage and use of different strength of the same medicine, and also how to employ the medicine, how to use the medicine, give the medicine. So when it comes to homeopathy, we can give the medicines in water, we can give it in a dry form. So I came to learn about the advantages and disadvantage of using different employing medicines in different forms. So that was one way breakthrough, in a big learning curve for me. So that also has really helped now. So now I'm a lot more confident, even if some cases become challenging. I have options now. Earlier, I was limited with options. Now I have more options to bring about. So the number of cases in which I'm failing have really come down.
So if I ask you as a layman, somebody is like not knowing anything about homeopathy, how do you explain me how does homeopathy work actually?
Oh, now the homeopathic medicine, the approach of the homeopathy is that it is not the symptomatological approach. So let's say a person comes to me with symptoms of asthma. He comes to me with symptoms of body pain. It can be seronegative or seropositive arthritis, or it can be just fibromyalgia. He might have some skin disorder. So suppose, so you have different parts of the body affected. Now, when we approach it homeopathic way, we don't give different medicines for each of these disease entities. We understand what these disease entities are. Basically, what is the pathology that is going on? What is so if he has a disorder, like if he has, let's say he has complaining of knee or some pains, whether it is an autoimmune disorder, whether it's a non-autoimmune disorder, whether there's any structural damage or not to this joints involved. Once that way, once the pathology is understood of what is going on, then we also study the. It's more of like a precision medicine. We study the individual. So the second part of the evaluation of the patient is, the first part is understanding what he's suffering from. The second part is evaluating the individual of the patient. And that is where the precision comes. So if, for example, with a patient with allergic rhinitis, let's take the example of allergic rhinitis. It is not one standard medicine. We would have at least 20 to 25 medicines from which we can choose. So the success depends upon accurate selection of the medicine for the patient. So here is where individualization of the patient comes. So that is the second part of the evaluation, and this is a very important part in order to affect the cure. So the homeopathic medicine, what it does is, it stimulates the our own ability to maintain health. You know, the homeostasis. When we are in homeostasis, then we are in health. So there are a lot of systems involved, just more than immunity. Immunity is just part of the system in maintaining health. So there are a lot of things involved. So the homeopathic medicine stimulates the mechanisms, the ability of us to maintain homeostasis. Once that is stimulated, we see diseases disappearing in a certain order, and that order is the most deepest or most destructive or the most serious disease will go away first, and the most simple or the most one with the least pathology. I'm trying to put it in very simple words. Least pathology will go away last. For example, one has a joint pain and one has an allergic rhinitis. That is sneezing. So with right homeopathic medicine, I would expect first the joint pains to go away, because that is deeper and more critical for the patient rather than the allergy or just the sneezing. So that is an order we expect. So with the homeopathic medicine, so the homeopathic medicine stimulates the main role of the homeopathy is to stimulate our ability to maintain health and to cure ourselves. That's how it works.
It is not having any side effects.
There is no side effects if the medicine is correct.
Okay.
If you are not giving the correct medicines, there is a risk of side effect.
Okay.
But the side effect is not like that. Well, when you're talking about side effect, what I want to clarify is when the medicine given is correct, there are no harmful side effects. When you don't give the correct medicine, what you can have is you can have a temporary relief, or sometimes you can have also, the patient might get worse. So the homeopathic doctor should know how to correct, if at all. So he should know once he gives the medicine, he should be able to, when the patient reports back, he should have the knowledge to understand whether the patient is getting better or not in the proper order. So there one should be able to, the doctor should be able to discriminate between symptomatic relief and proper cure. Because sometimes for a patient, the allergic rhinitis or the sneezing might be a more of a issue rather than the joint pains. So the patient might come in, my real problem was my sneezing. That has gone away. Joint pains I can tolerate. But to me, that means the medicine I've given is not the right one. So I have to, because I knew sooner or later, he might land up in a more serious issue. So then, or if I am having a patient with some allergic manifestation of skin, let's say urticaria or a milder form of allergic manifestation on the skin, I treat the patient and the skin goes away. And then after a few days, he comes and says that he's having a cough. That means I have driven the disease inside. So my medicine was not right. So I should have that knowledge to understand what I've done is right or wrong. If I have the knowledge, what I'm able to quickly correct, then get his cough back is then if I get the right remedy, right medicine for him. So here is where again we come to the precision aspect. If my medicine is precise, his cough will go away, his skin will temporarily come back, and then he will cure.
So what are diseases you have cured?
I have cured a lot of diseases. I've cured. I've been able to take patients of, save patients from probable surgery for intervertebral disc prolapse. I've had many successful cases where it was they were given an option of surgery or going with their living lifelong with their pain. So I've helped a lot of patients with intervertebral disc prolapse to get back on their lives. I have also treated a lot of asthmas, skin diseases, allergies, allergic rhinitis. Then even more serious issues were cases where there was a case of a gentleman who had, who was chronically dependent on CPAP. He was having, this, I don't have the record right with me. He had a problem with his larynx where it was getting slowly constricted. Okay. So it was in another clinic where I go to. I don't have the case right with me. So in that case, it was very difficult. He was not able to even step out of the house. He would get a severe cough, breathlessness, severe issues, and he was chronically dependent upon CPAP. So that gentleman, he came to me and he was on this for the last 2 years after COVID. He came to me and within the span of 3 to 4 months, he could take away CPAP. He can now go out. He was not able to go to work. He was in the construction field. He was not able to go to work. So now he's back. He's employed back. He's able to do his work. So that is one case which really gave me a lot of happiness. Then I've cured a lot of cases of adenoids in children who were probably recommended for surgery. So that has happened. And then I've also helped a lot of children with behavioral disorders, including autism. Autism, I would not say I've completely cured anybody, but I have really made a lot of difference to those children. With behavioral disorders, I have cured children with behavioral disorders, violent temperaments, children who have an attention deficit. Then also I've cured cases, people with neurotic depression, not just the psychotic depression, but neurotic depression. There was a girl who was doing her MBBS and she was having OCD with a lot of intrusive thoughts. The life was very miserable for her. She was dependent upon antidepressants for a long time, but that was no, it was not. She was with antidepressants, she was better, but not really cured. She was still struggling with that. So she got cured within a matter of 6 to 7 months. She's off antidepressants. She's really free of her intrusive thoughts, really happy, able to do her work. So this is all, these are a lot of things I can recollect from my short memory. If I look into my database, I can come with more. So
You have significant number of success stories.
cure means one at one time I stopped the medicines.
Very good.
I stopped the medicines and they are off medicines, all medicines, either it's homeopathy, modern medicine, Ayurveda, everything. That's my objective. No, when the patient is healthy, you're off medicine. You don't need medicines, be it whatever.
So many doctors who are actually studying homeopathy, they work as a allopathy practitioner or do some. So what do you want to say them? Homeopathy is a very good branch, and you can practice homeopathy and be successful.
Yes, definitely. Homeopathy is the medicine has this amazing potential to heal the person, completely give your health back to you. It has that amazing potential, the homeopathic medicine, but you need a lot of knowledge in depth to be able to deliver that, because like I said, the key part is individualization, the precision getting, because once you've done the disease evaluation part, the first part, then you have 20 to 25 medicines in front of you. So there is where your depth of knowledge in homeopathy helps you to pick the right medicine for that person. Once you're able to do that, then the treatment that is one challenge, that is one most critical part of the treatment. Once that is done, then the rest is a little more easy. The comprehension of the principles of how to dose, etc., is a little more easy and little more manageable. But the part of choosing the right medicine is it's a very critical part, and where you need a lot of knowledge. And that knowledge comes along with experience, plus if you are able to link with these academies, that will also help.
What is your message for a budding doctor?
For budding homeopaths, I would say, invest time in getting the clinical knowledge, getting really grounded and getting the fundamentals of clinical knowledge clear first, and then also get the fundamentals, start with the fundamentals of the homeopathic, how the homeopathic approaches towards a patient, and also there are certain tools of the homeopathic medicine, like what we call as repertory. So earlier it was basically based on books, now you have softwares. So that tool is of immense help in practice. So that also one should be very good at. You should develop your acumen and expertise with that. So start with the fundamentals and build it up. If you are in a college, I would say by the third year, at least second year, go to a college where they will give you exposure to the clinics. If there's a college which gives you exposure from the first year, very well and good, or at least exposure from the second year onwards to the clinics. And there you try to understand, how the basic of homeopathy, how it is being applied, what is happening. Use your clinical knowledge to see whether the patient is really improving. All that expertise you should gain as you go forward. For those who have already passed out of your undergraduate course and if you're still confused about how to go about your homeopathic practice, I would say take time from your practice, to attend one of these academies with their training programs, that will help you to get your fundamentals out, clear and crisp. Once that happens, you will see a change in your practice.
It's a great word of wisdom. How has been your experience with the Doctorpreneur Academy the last 1 year?
Yeah, the Doctorpreneur Academy, it has been a very good experience, and basically, I like the team. I like the team, the way and the resources they have made available to a doctor, and these resources, it's available on a single platform. And that is something of that's an invaluable asset. And it's a lifelong. You can use it at your convenience. It is not something that expires. It's not a membership that expires in a given period of time. So if your life is busy, you can use it at your convenience, and it is always there available for you. And you keep on enriching the resources. You keep on getting it better. And also the financial planning tools, that also giving you an opportunity. And it also helps you because as a doctor, you would have little knowledge about how to set up a business. But that is inevitably important. That you will realize sooner or later in life that the financial skills are equally important to secure things. So that is not available outside easily. And you're having a credible team who's giving that also to you. So that way it's a wonderful platform, which I would recommend.
Great. Thank you so much for giving your time, sharing the knowledge with us. And we appreciate that your efforts, and you are open to suggestions, and you're ready to train other people if they want they get some guidance from you. So appreciate that, and I appreciate your knowledge and wisdom that you have shared about the postgraduate studies and the extra additional courses you should be doing for the young budding doctors and importance of that. Thank you so much for your time and your words of wisdom.
Thank you, sir. Thank you for having me with you. Great talk.
And for the audience, if you want to understand how we have helped Dr. Sandeep and many more like that, there is a link below of the webinar. You can join the webinar and join the webinar. Thank you so much.
Thank you.
Sir, you must do a franchisee. You are all set to launch for the franchisee now.
Yes.
You can make a model of right now what you are doing and SOP for that. Then you just replicate it in various places. If you want any help, you can contact us.
Sure. Thank you.